even if they're small changes, they can add up and make a big difference in regards to our blood pressure. So things like eating more nutrient-dense foods, reducing our sodium intake, being more physically active, learning how to manage our stress appropriately, cutting out tobacco of any kind, and of course taking our medications like our doctor has prescribed. But also, you might be encouraged to monitor your blood pressure at home. And that would be a way that you could keep an eye on what your blood pressure is running, but also learn patterns. For example, what things are causing your blood pressure to increase, so that you can be aware of maybe some continued changes that you could make to lower that number.
According to Kansas Health Matters, nearly 1/3 of adult Kansans have been diagnosed with hypertension or high blood pressure. K-State Research and Extension is involved in a pilot program that focuses on hypertension awareness, self-monitoring, and prevention. On today's Sound Living, adopting a heart-healthy lifestyle. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Sara Sawer, the Nutrition, Health, and Wellness Agent for Sedgwick County, and Stephanie Gutierrez, Extension Program Coordinator for the K-State College of Health and Human Sciences, are co-coordinators of the Hypertension Awareness and Prevention Program Pilot Project. Stephanie, in terms of getting started, I think maybe the logical place is just to start by covering some of the basics of high blood pressure and essentially what is hypertension.
Sure. So when we talk about high blood pressure, we actually use the term hypertension with that interchangeably. Once you're diagnosed with high blood pressure, your diagnosis would be hypertension. And so when we think of high blood pressure, we want to really identify what is blood pressure to begin with. And blood pressure is when your heart beats. It creates pressure of your blood flowing through your arteries and veins. And this pressure makes it so oxygenated blood can get through to your organs, your muscles, and the rest of your body. Unfortunately, when your blood is pumping through those blood vessels at a consistently high pressure, you develop hypertension or high blood pressure. And that can be detrimental because it makes your heart work harder, and it also deteriorates those vital blood vessels. So that can lead to all sorts of problems.
For people in Kansas, are we seeing a high prevalence of high blood pressure in the state?
So as far as our Kansas communities, we're not too far away from the national average. So in 2021, 34.3% of adult Kansans reported having a diagnosis of hypertension. And compared to the national average, that's 32.4. So we're not too far away. But when we break that down in terms of who's showing incidence, when we look at populations who have less than a high school education, they have higher incidence levels of hypertension, as well as Black men, individuals over the age of 65, and individuals who have an income below $25,000 per year. So we still have some work to do in Kansas to make sure that we're keeping our communities healthy.
I know when we're watching medical programs, we will often hear someone say, blood pressure is 110 over 70. What are those two numbers, and what are they actually measuring?
Good question. So, like you said, blood pressure is measured in two numbers. The top number is the systolic pressure, and that indicates how much pressure your blood is exerting against your artery walls when the heart beats. So if we were to look at a monitor and it said 110 over 67, the top number, or the systolic pressure, would be 110. The bottom number, or the diastolic pressure, indicates how much pressure your blood is exerting against your artery walls while the heart is resting between beats. So again, if we use the example 110 over 67, that bottom number, the diastolic pressure, would be the 67, and it's measured in millimeters of mercury. So that's how blood pressure is measured. It's systolic over diastolic.
So we know kind of what the normal is. Then what happens when we start seeing those numbers change?
So normal is recorded as a systolic less than 120 and a diastolic less than 80. So when we see it start to elevate, an elevated blood pressure would be like a systolic of 120 to 129 and a diastolic less than 80. But when we really get into the danger zones, we see numbers sort of over 130, over 80. That's when you would want to see a provider and start talking about lifestyle changes and possibly medication.
Well, and Sarah, that's kind of where you're coming into the conversation, is the fact that there are some things we can do to manage high blood pressure.
Yes, there are quite a few things that we can do by making some changes in our everyday lifestyle. So even if they're small changes, they can add up and make a big difference in regards to our blood pressure. So things like eating more nutrient-dense foods, reducing our sodium intake, being more physically active, learning how to manage our stress appropriately, cutting out tobacco of any kind, and of course taking our medications like our doctor has prescribed. But also you might be encouraged to monitor your blood pressure at home. And that would be a way that you could keep an eye on what your blood pressure is running, but also learn patterns. For example, what things are causing your blood pressure to increase, so that you can be aware of maybe some continued changes that you could make to lower that number.
You covered a number of things there that we can do. So let's go back and talk a little bit more in depth about eating nutrient-dense foods. What type of foods are we talking about?
So instead of thinking of foods as good or bad, I like to think of it in terms as more nutrient-dense foods versus those calorically dense foods. So more nutrient-dense is things like fruits and vegetables and whole grains. So getting more fiber. So 100% whole wheat or whole grain bread versus white bread. 100% whole grain tortillas versus the white tortillas. Brown rice versus white rice. More lean meats and proteins. Getting more nuts and seeds and legumes in our diet. So beans, peas, lentils. Choosing more low-fat dairy foods. And then focusing on more of those heart-healthy fats. So olive oil, canola oil, even unsalted almonds, walnuts, and more of those heart-healthy fats in regards to fish. That might be salmon, mackerel, or tuna. And then as we're increasing the fiber, we want to make sure we're increasing our fluid as well. Thinking about it in a way of, what can I add to my everyday eating plan versus what do I have to take away? So we can add more of those nutrient-dense foods that have more fiber and that healthy fat, and that's going to help keep us full longer than if we had that calorically dense food like cake, cookies, pie, that type of thing. And watching your portion size. When we're eating more highly processed types of food, that's where you're going to get a good amount of sodium in your everyday diet. So by eating more fruits, vegetables, whole grains, lean meat, and watching those portions, that's going to help decrease that sodium intake.
And why is that important? Again, how does this fit in? Because I know that's one of the things they always talk about is watching sodium intake.
Right. High sodium diets can elevate that blood pressure. So that is why it is really important. As Stephanie had mentioned, when your blood pressure is high, that can put you at increased risk for heart attack and stroke.
Consistent physical activity is also another way to help manage high blood pressure?
Yes. By being active on a consistent basis, that can help lower that blood pressure number, but also can help people with a little bit of weight loss and some weight maintenance, which also can help with blood pressure. But it also helps with a number of other things. It helps increase our confidence and our mood, can reduce depression, alleviate that stress, increase our energy, and help improve our sleep, which is so important.
These are changes that really are not difficult to make, may take a little bit of effort in the beginning, but I imagine as you start to make these changes, it just kind of becomes a new way of lifestyle?
Right, exactly. And so I think one thing that's very important for people is not to take off more than they can chew. If we try to change everything at once, then life tends to happen and we get overwhelmed. And then we may go back to those previous habits. So picking one thing, whether that could be, I'm going to take the table salt off the table, or I am going to pick 2 times a week where I'm going to go on a walk for 10 minutes each time. And that may not be hitting our goal of 150 minutes per week. However, it's a start. And so once we consistently do that 2 times a week for 10 minutes, it becomes a part of our routine. And then we maybe build upon that. We increase it to 15, or, we pick something else. And it's building those small changes one by one that can add up over time and make a big difference with our health.
In terms of the program, how will you be getting this program out to Kansans, and what all have you gone through to really prepare for this program?
The Hypertension Awareness and Prevention Project is a self-monitoring blood pressure program that we are piloting across Kansas in 11 different counties with a partnership with the Kansas Department of Health and Environment and the Kansas Business Group on Health. And the purpose of this 4-month program is to coach participants to learn how to appropriately manage their blood pressure at home, what that consists of. So it's not just going in, getting your blood pressure checked, and then that's that. There's really some things that you need to do in order to get an accurate reading, and for them to chart that and to understand what types of things could be causing their blood pressure to run high. But also it will serve as an empowerment for people to be an advocate for their health and maybe give them confidence and know what types of things to ask their doctor or when to call their doctor, but really just giving them the tools and the confidence to manage hypertension and ultimately just be able to enjoy their life longer.
I think we've all had this done at the doctor's office. It doesn't seem like something that's difficult to do. This is something that one person can manage themselves in terms of actually taking their blood pressure?
Yes, absolutely. So the 4-month program, we start with a kickoff meeting where our participants that are enrolled will come in and we'll tell them about the program, and then they will be taught how to take their blood pressure appropriately, making sure that 30 minutes before they're not exercising, not drinking any caffeine, smoking, no alcohol for at least 30 minutes, because that can affect that reading, making sure that their bladder is empty, that they're wearing the appropriate clothing so that the cuff can get an accurate read, and that prior to taking their blood pressure, they are relaxing and sitting quietly in a quiet place for 5 minutes. And so they will come in twice a month, and the first time they will receive their own electronic blood pressure monitor to use at home. And then they'll be, of course, taught how to do that. And then they'll also be doing that at home a couple times a month as well. We also will have the opportunity once a month to invite them to nutrition education workshops. The first class is on sodium. The second one, we're going to be covering those heart-healthy fats and on cooking and then eating out when you're on the go. So there's going to be a variety of different things covered. So it's not just on the taking your blood pressure, but it's really to get them into that habit and that routine that we talked about and learning what they need to be aware of and how to do things properly and feel more confident and empowered.
And is there a way that they can find out more information now on this if they would like more information?
I would encourage them to call their local county extension office and say that they heard about the Hypertension Awareness and Prevention Project and they want to know more information. And if there isn't a pilot offered in their county, we might be able to get their name and information and keep them in mind for the next time that we offer this.
That's Sara Sawer, Nutrition, Health, and Wellness Agent for Sedgwick County, and Stephanie Gutierrez, Extension Program Coordinator for the K-State College of Health and Human Sciences. They are the co-coordinators of the Hypertension Awareness and Prevention Program Pilot Project. Again, for more information, contact your local county or district extension office. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.